Hi guys, welcome back again. If you're new here, my name is Nurse Rachel and I share valuable information for nurses and I bring you informative immigration updates. So if this is what interests you, please again don't forget to subscribe to my channel. So in this video, we'll be discussing how to become a public health nurse in Canada. And Nurse Christy is here with us to share her experience, everything she's done so far, how she transitioned from RN to ROPH or RNPH, whichever one. Okay, so and I'm really happy to have her here because every time, every hour, every minute here in Canada counts. Okay, so I'm really happy to have her here. I'm a registered nurse currently practicing here in Canada too. So I decided to bring her here to share her experience with us and let us know of future nurses who are interested in transitioning from RN to public health or any other specialty that's not bedside. Nurse Christy, we're happy to have you here. Could you please tell us a little bit about yourself?
Thank you so much, Nurse Rachel. Hi, everyone. I am Christiana, but obviously I prefer Christy. And yeah, and I am a registered nurse here in Canada. And I initially was a registered nurse midwife in Nigeria before I came down to Canada. And so far, yes, I'm a nurse, as you know, as I've already said. Yeah, I think that's all. Yeah.
Okay. So how did you come to Canada? Let's
Oh,
start
dear
from there
Lord.
because this is the most important part. You need to tell us how
Oh.
you came to Canada. Did you jog? Did you run? How
If
did
it
you
was
come
a
to
short journey,
Canada?
actually, yes, I think jogging would have been best, but then no. So I came into Canada with my husband, and but I came in with a work visa actually.
Okay.
And yeah, but now the thing is, when it comes to the work visa, there are two different kind of work visa. There's either an open or a closed work visa. But I did come in with an open work visa, and what an open work visa implies is that you could literally work anywhere and work for any employer. Yeah, but my husband is also a nurse. Yeah, but he came in with a closed work visa. So yes.
Hmm. Okay. So were you interested in public health before now? Like, were you interested? Were you doing public health nursing back home? Do you have any interest in public health at all before now? Or you just came in and boom?
Oh no, it wasn't like a decision that just came abruptly. I actually did love. I've always wanted to do something community related, and yes, I think I kind of had like a desire doing public health back home, but it wasn't something that came immediately. I also had like prior experience as a public health nurse, but it wasn't fully as a public health nurse because as a registered midwife back home, you kind of do most of the jobs a public health nurse can do based on the postnatal and the prenatal care, but you also needed to like go for more training if you needed to do like immunization, right?
Mm-hmm.
So it was mostly like the prenatal and postnatal care for me back home, and also some of the immunization too. So yes, I had prior knowledge from public health back home, and I also had the desire of wanting to do it, but I didn't know it was something that was going to happen so fast. Yeah, and yes, and I think I kind of love it too. Yes.
Okay. Now, how did you become a nurse in Canada? Because this is another important part. I know it's kind of related to how you transitioned into becoming a public health nurse. So just let us know how you became a nurse in Canada.
Okay, so when it comes to becoming a nurse in Canada, it's kind of straightforward. Sometimes it can be long, but I think it's straightforward because mostly what you need to do is first of all you have to be a bachelor's degree holder because Canada does not accept degree like like back home we call them people that went to
School
like
of
the school of
nursing,
nursing. Yes.
diploma. Yeah.
So it's like a problem, and so you have to be first a bachelor's degree holder before you become a nurse in Canada. And
Okay.
then it now depends on the province in which you are trying to get your licensure with, right? Some
Mm-hmm.
province it's very daunting with some province. Some province it's not, it's more like straightforward.
Okay.
So everything depends on which of the province you want to be licensed
You're
to.
interested in, yeah.
Yes, yes. So that is it's because it's going to attribute to how fast your process is going to go or how slow it's going to go to. So that was also
That's
one of the
correct.
major things too. Yes, I did experience. But being a nurse here in Alberta, it wasn't so bad. Yeah, the licensure was kind of straightforward to an extent, I would say. Yeah, because mostly I think what you need to do is like do the West evaluation. That's when you get to evaluate your credentials from back home to what Canada entails or what Canada wants, right? And if they
Canadian
find that
standard, yeah.
yes. So if they find out your credentials are up to the standard in which they want and there's no falsification, because that is one thing too they always look out for. If there is
Mm-hmm.
any atom of falsification in any of your documents or in any of your file or anything related to anything is submitted to them, it's a total no-no for them. So
Mm-hmm.
those like are the things that they look out for. And then if you're good with the West is World Education Services, and they are the ones in charge of the credential evaluation here.
Evaluation.
So if they do those things and then they find out that you're up to the standard, you're cleared with them, and then you can go to the board of nursing and then start your licensure processes. Yes.
Okay. And were you able to pass your NCLEX before you became public health nurse? Like, could you please share your NCLEX experience with us? Because I know a lot of nurses are watching today, and some would also watch in future.
Yeah.
Personally, I'm not going to lie to you. I was scared about this exam. So anybody that is telling you that this exam is easy, I was so
Mhm.
scared. Okay.
Yeah.
When I started studying for this examination, I had to try any material I can lay my hands on. But as time goes on, and as I started like mentoring people, like helping people with the
Mhm.
process, talking to people that have already passed the examination, I discovered that you just need like one or two resources, like
Yeah.
just master your content and all those things.
Yeah.
So I had to go through anyone I could lay my hands on. So I just want you to like share your NCLEX experience with us, because I know you just did this examination recently. You can just
Yeah.
share your experience with us, so maybe like other nurses could like learn one or two things from you.
Okay. Actually, I got licensed last year,
Okay,
and now
congratulations again.
thank you. Actually, yes, it's something that is what you get in the congregation every now and then because it's a big milestone for anybody to be able to accomplish, right?
Mm-hmm.
So,
Mm-hmm.
like when it comes to the NCLEX journey for everybody is literally like it's different, right? Because
Mm-hmm.
I would say everybody's mode of studying or assimilation strength is really different. So you
Mm-hmm.
always have to know, this is what I tell my friends. You just need to know what works for you and try as
Yes.
much as you can to make a good plan with it, right? And I would also say try as much as you can not to study for a very long time. Because if you get
Okay.
to study for a very long time, it is daunting. Like you can imagine when if you give yourself like you have to read for like maybe 4, 6 hours or sometimes 8 hours and you have to do it for like a whole year, you would
Yeah.
definitely slack. But
And
if
at some point, you feel like you're not even doing enough.
oh yes,
You know?
because there's a whole lot of material for you to cover. And
Yeah.
classes, it's I don't know, but sometimes I feel like he's the biggest guy when it comes to nursing. And actually, it is because when you get your NCLEX, like you are being licensed to literally work in any first world country, and that is a major milestone. Like it is one of the achievements. If any nurse gets it, I think you're good for life, right? So now the thing is, while I was studying, I literally told myself I was going to write my exam in a space of 6 months. So I kind of strategized. I did more studying because you need to have a good foundation. Actually,
Yeah.
you know that place in the Bible when they said, if the house is not built on a good foundation, it will fall. Yes.
Yeah.
If NCLEX is not built, if your NCLEX preparation is not built on a good foundation, I bet you might be lucky, but luck in NCLEX is like 0.00001%. So you know it's not
Yeah.
suitable, right?
Yeah.
You need to get a good foundation, and this good foundation comes with you first of all having the basic knowledge, reading what exactly is NCLEX for, how is their question answered, what are the things you need to know, right? There are some good materials out there, like you don't have to literally bounce on anything you see online.
Mm-hmm.
because most persons, what I see, they just want the traffic because they know you are you literally want this thing, right? And they would want to take advantage of those persons. But if you know what you
Mm-hmm.
want, you know some good materials. Like I know when I was reading at some point, I was able to stumble on Saunders, but I didn't use Saunders for a very long time because for me I felt like Saunders was just so much, right? And I was not so sure if I could finish Saunders in the 6 months I told myself. So, and I
Mm-hmm.
needed to be very, like, I was very, very strategic about what I wanted, and I was going with my plan. I knew how I wanted to read. I knew my assimilation mode and when I kind of read best and understand best, right? So that was what I
Mm-hmm.
was doing. Now, this is the thing. They're good materials. Like, I used UWord, and then there's this guy too on YouTube. I used, he was mostly when it came to like me answering my question. That's Nurse Crusader, right?
Yeah.
He's very good. He's very good. Like, he kind of, when this his 7 days training, I think I kind of did two of them, and that was my breakthrough actually. That was my breakthrough because, and also, like, I would say, if you're planning on your NCLEX, like if you know you want to write it, if you plan with the 6 months, like if you do the 6 months plan and you study for the materials, get the basic knowledge, like all the system, pharmacology, EKG, and everything, if you can be able to cover it in 4 months and use the remaining 2 months to do your touch base, like do all the whole finishing touches with your question banks and everything, I think you're going to be good. Because
Okay.
because if you have a good foundation, or you have a good basis when it comes to the basic knowledge of what NCLEX is and how their question comes and how they get to put their questions. If you know those things, because this is how NCLEX work, you are going to be put in this question like it's a life scenario, right? Now, if you're not thinking fast, if you don't have this basic knowledge, if you don't know what you're supposed to do at that particular time, you're going to fail that particular question, right? So
Yeah.
you need to first of all know how this question goes. What am I supposed to do on a norms? And you don't bring in like
Personal
your
knowledge, what you
experience. Oh
think.
yes, no, it doesn't work with NCLEX. That is one thing I found, that your personal knowledge doesn't work with NCLEX. NCLEX is a book exam. Is what they want. That is what you have to answer. So the
Mm-hmm.
computer might not know that you know this thing. Like maybe you use this other way outside of NCLEX and it worked for you, but that is none of their business. It is what they wrote. Whatsoever question and answer they give to the computer, that is what you have to answer. So you need to literally know the basics for you to be able to scale through NCLEX. Yeah.
Mm-hmm. All right. Thank you so much for this information.
Sure.
And now we're just going to talk about the most important thing that brought us together today. We have
Yeah.
some people watching us live. I was unable to go live on Facebook for some reasons, but I just hope I'm going to share part of this video on Facebook so more people can access it. Now, you're just going to tell us some of the requirements. We're just going to have like a general requirement because I know that when you're trying to get any form of licensure or registration in Canada, each
Hmm.
province have different requirements. So like
Yeah.
just give us like a general idea of what it looks like, the requirements, and how international educated nurses can access this information.
Okay. Like as I said, when it comes to Canada, their major lookout for nurses are bachelor degree holders,
Mm-hmm.
right?
Uh-huh.
And then if you're able to scale through with that, you get your licensure with any province you intend to, like let me say like
Mm-hmm.
Alberta or Ontario and the rest of them. So if you're able to do that, now the good thing about these things is that there are so many informations online, but you just need to know where to search, right? You
Mm-hmm.
just need to know where to search to get the proper information because there are some jargons out there too. So if you're able to get this information, know what exactly the province you're intending to get registered or get your licensure with in are looking out for, which the major thing for any province in Canada is your BSN,
Mm-hmm.
right? If you get your
Yes.
BSN, and then that is like one stepping stone to you getting whatsoever you want when it comes to
Mm-hmm.
being a licensed nurse here in Canada. Yeah.
Okay. Um, I also heard that you also need your RN license to transition into public health nursing here in Canada too. Is that right? Or like, do you have to right do any specific examination? Like for example, I know you were already an RN before you transitioned into public health nursing. So for international educated nurses, do you think they also need to like pass the NCLEX before becoming a public health nurse, or there is a specific pathway for public health nurses planning to practice in Canada to just do their own licensure examination and transition completely?
So now this is how it works. You can't work in another country with the license you have with another country. You have to be licensed with this country, like you have to write your NCLEX, right?
Mm-hmm.
So for you to be a registered nurse in Canada, the first thing you should look out for is writing and passing your NCLEX.
Okay.
Okay. Yeah. So
Mm-hmm.
if you're able to write your NCLEX and pass your NCLEX, and then you can now verge into any other specialty you intend to. Like your RN here is a major breakthrough in Canada. With it, you can be whatsoever. But then now it now depends on which of the specialty you want to go to. There are some
Mm-hmm.
specialties that require you to get a whole lot of hours from your like your working hours, right? Before you can be able to look into it, because they know you need these experiences for you to be good at this particular specialty. So those are the
Yes.
things, like your RN is the major thing. That is what I would say. Yeah. So
Okay, so if you get a BSc and your RN licensure, then you can. That means people that are even outside of Canada cannot access this information, because I also read something about work experience, additional certifications, and I think language or criminal check, something like that.
yeah. Yeah, language or criminal check is needed for any job here, because they need to
Mm-hmm.
be certified that the whoever they are putting in your care is going to be safe, right? So
Okay.
those, yes, so that is one of the requirement that comes with any job here. And when it comes to the English proficiency exams, this is where West comes in. Because if West is evaluating your credentials and is making it up to Canadian standard, you do not need to write IELTS again,
Okay, for
or
licensure,
any of the
right?
English exams. Yes, or any of the English exam. You don't need to write any English proficiency exams. So if for any reason you are wanting to do nursing, and this is what you're outside of Canada, because sometimes as an international educated nurses, everybody goes through the same process depending on your province, right? For the province where I am, which is Alberta, it was mostly the West evaluation and then straight down to license
And
to
you
the
did most of this process when you were in Canada,
yes,
right? Okay.
I actually started my process while I was here. Yes, I didn't do
Okay.
it from outside of Canada. Yes.
So what do public health nurses do here? Because I know that it's different from the bedside nursing roles and nursing responsibility and everything. What does it look like to work in a public health setting? Because I remember their time is short, is soft life.
No, I don't know why you always call it soft life anyway,
I
but
call it soft life because you enjoy it.
oh my god, oh my god. No, it's not soft life. It's not. It's not soft life. Like literally, almost everybody thinks like public health. You come there and you don't do any job. Like you're just maybe sitting down. But it's different. And I'm not here to justify anything to anybody. But the thing is, when it comes to public health, right? Public health is more of the brain work.
Okay.
Like I have this colleague, she would always say public health is for nerds. You have to be a nerd for you to work in public health, because you need to be patient enough to read, because there's a whole lot of materials. And today there might be this outbreak. You have to have literally every knowledge at the tip of your finger about this particular disease and how to go about it. And there's always changes, like maybe let me say for a biological product of a particular vaccine and the rest of them, there can be modifications, right? So you need to be up to date to
With most
whatsoever
of
is
this
yes, is
information.
out there, so you don't put these patients at risk. So yes, you have to have the patience of wanting to do your research, wanting to be able to sit down and know whatsoever is out there and good materials too, right? Now,
Okay.
yes, the working hours are short because we don't work like the 12-hour shift. So we do like the 8-hour shift. But I would say sometimes it can be draining because you're doing more of a brain work, right? And the brain work I think is even more exhausting than the physical work because your brain drained. Yes, there are times when you're literally in the front of the screen and you're trying to figure out a particular thing and you might even forget to have lunch. Like yes, it happens sometimes. So it goes with the flow. There are days that, just like as a bedside nursing, there are days when the hospital is not so busy, right? And there are days when you have like an inflow of a whole lot of patients. So yes, so
Yeah.
but it's not substantial.
Okay, and you're also saying that do you think internationally educated nurses need like any form of Canadian experience? For example, do they need to work in like a bedside setting before transitioning into public health? Because what I understand from what you're saying is that you somehow need to be here to access most of this information, if I'm not saying the wrong thing, right?
Yes, I think so. Yes, because I haven't heard, neither have I seen the public health nurses being brought in from like not already in the country per se. So
Okay.
I stand to be corrected actually. I don't know, so I don't put out the wrong information there. But I think most times they do it from what they have here. Do you
Okay.
get? Yes.
Mm-hmm.
And now they can be like a demand. There's always a demand. Not like they can be. There's always a demand for
Mm-hmm.
public health nurses because we need
Yeah.
manpower. We need people to be out there in the community. There's a whole lot of work to do as a public health nurse. It's not just all about the vaccines and everything. No. Yeah, people feel like it's all about immunization and the rest of them, but there's more to it than just that.
Mm-hmm.
So yes, we kind of need manpower and we need people that are willing to go into the community because you're literally a community health nurse. You need to know what is going on wherever you are. So I think yes, that is why most times you have to be here first before you access those jobs. I
So,
think
what are like the key skills that are expected from public health nurses, especially people that are coming from outside Canada?
so now this is what you should know. Definitely things are different from wherever you're coming from to wherever
Yeah.
you're going to. Yeah. So first of all, your personality matters a lot, right? So you need to have like a good social skill. That is one.
Mm-hmm.
Because you'll be interacting with a whole lot of persons, interacting with both the young and the old in the community, right? So
Mm-hmm.
the major thing, or it's not a major thing, but it's one of the major things
Mm-hmm.
as a public health nurse. You need to know how to have a relationship with the community personnel, know what exactly is needed in this particular community, know how to help them, know what they need. Because, and also, like, whoever you are attending to, imagine if you are a total stranger. I wouldn't have
Mm-hmm.
trust in you wanting to open up. This is what I'm like going through, and this is how the kind of help I need, and the rest of them. So you need to be able to connect with those persons, like the people in the community. You need to be able to know how to reach out to them, and also patience is a virtue. Actually, yes, when it comes to public health, yes, patience is
Mm-hmm.
a virtue. So you need to be patient enough because you are working with different kind of persons. And I also think like you being able to work with team members is also a major goal too. In fact, I think
Mm-hmm.
the skills and the qualities of a good nurse is what is needed for you to be a public health nurse. It's not much of a difference because these things are the things I would do too if I was a bedside nurse to be able to be a good nurse to my patient. So those qualities and those attributes a good nurse in another specialty needs is what a public health nurse also needs. So those are the things whoever wants to be a public health nurse should look out to be good at it. Yeah.
Okay, I'm just going to do a quick recap of everything you just told me now so we don't miss out on any information. So you
Okay.
said the first thing we need here is a bachelor's of nursing science. So without this, it's likely possible that you're not going to get into any of these roles. And I one thing I think is that if you don't graduate like from a university with a BSc, you may not likely get more opportunities here in Canada as a nurse. Is that right? Because I know in the US it's a little bit flexible. So whether you're
Hmm.
graduating with a diploma or you're coming out with a BSc, you like have
Hmm.
more chances of getting into nursing. Like it's
Yeah.
easier for
Yeah.
you to like get your RN license in the US than here in Canada, if I'm
Yeah. Yeah.
okay.
Actually, yes.
So, and this must be like a 4 years BSc program from a recognized university. You
Hmm.
also need your nursing licensure, which is your RN license from any what's it called, like
Board of nursing.
regulatory body in Canada. We have about 10 of them or more, so you
Yeah.
can just like look up most of those information. I'm also going to put out some resourceful links on the description of this live section. So you need your RN licensure in any of the province. To become an RN, you must graduate from an approved nursing program, pass your NCLEX RN exam, and apply for your licensure with the appropriate regulatory body. You also said something about work experience in Canada or outside of Canada. It depends, but I know it's between 1 to 2 years. Of course, if you're planning to become a registered nurse in Canada, you should at least have some form of experience from whichever country you're coming from. You also said something about additional certifications, but this part is optional, I know. So you also need like your CPR, your first aid, immunization certification, especially for roles involving vaccine and people that are interested in working in clinics. Mental health, first aid, public health nursing certifications through the Canadian Nurses Association. This is not mandatory, but it could also like add
Yeah.
to
Kind of, it kind of
your
spells you
it,
out
it
more.
boosts
Yeah.
your credentials. And
Yeah.
you also talked about the skills that are important in public health, which can include strong communication, ability to work independently, culturally sensitive and aware of social determinants. This is just like the very, it's general, it's not just in public health. You need to be
Hmm.
you need to be up
Oh
and
yeah.
doing when it comes to it,
Oh yeah.
because you're
Oh yeah.
working with people from different walks of life.
Oh yeah.
Okay. You also said something about criminal record check and immunization if it's applicable to us, right? And you said that the language is not really necessary because we already have an evaluation done for the what's it called, the registration,
Yeah.
right?
That's for your
Okay.
credential evaluation. Yes.
Okay, so now apart from the number of hours you've worked, could you please like give us what it looks like? Because I mean, if I'm planning to work in Canada, I should know that I'm getting some, just tell us what it looks like.
So
Tell us
now,
what it looks like.
when it comes to um, you mean like the pay, right? Like what is
Yes,
the
what it looks
expected?
like. And
So,
I'm not telling you to tell us what you're earning
oh,
because I
oh,
know
obviously no. I don't know who is seeing this video. No, no. Okay, so now this is it, right? Um, here it's it has been it's like in a normal thing. Every nurse, once you're licensed and you're working, there is a basic pay for you to start. Okay, but then there are things that kind of gives you a raise in your step because they pay you based on your step. Your first step pay is like the regular for every nurse here in the particular province you're in. My pay per hour in the province where I am is different from how much whoever is in Ontario or New Brunswick is going to be getting. But there is a basic pay. Okay, that is how it works here. And then now going forward, your past work experiences,
okay,
the qualifications you have, like if I am a
okay.
master's degree holder or maybe a PhD degree holder, those things also add to
Yeah, I
your
remember
wage.
I was asked to submit my proof of previous experience and it
Oh
really
yes,
helped a
oh
lot.
yes, oh
Yeah.
yes, oh yes. So those things are things that add up to your pay, right? But it is not a bad pay. Do you understand? Depending on what you want, because if you're working 8 hours, it's different for somebody that is working 4 hours. Coupled with the fact
Mm-hmm.
that we are being paid per hour, right? So you can't
Yes.
can't have like it cannot be a balance from 8 hours and 12 hours. So those
Yeah.
are the things you're looking at. If you're going to be working as a public health nurse, you have more time for yourself, for your
And your
family.
family.
Oh
So
yes.
are you saying it's mostly for people who wants to have time for that? Because the truth I know is that not everybody wants to just come and like walk. Because when you're moving into a new country, some people wants to buy a car, some people wants to buy their first home, some people wants to start investments back home. So that's why you see most people they just want to work their life out from Monday till Saturday. I don't know if you understand what I mean. Why some people just want like a stable life for myself and my family where I just go to work, I still have time for my children, I still have time for my family. Do you understand what I mean? So like you're saying that public health is just for people who wants that time for their family. Is that what you're trying to say?
I wouldn't say it's just for people that want time for their family. It all depends on the individual need and your priorities,
Mm-hmm.
right? If you're
Mm-hmm.
somebody that really do not want to have like a disruptive time because of work, you can venture into it because you have like a good hour to yourself. And if you're maybe it all depends, yeah, because I can't say this is what you should do because you want more hours. You can be having a family and then you need money to be able to keep your family. But would you be okay with whatsoever you get for an 8 hour job? Do you think there will be a difference if you had worked a 12-hour job? So those are the things you should put in place, right? When you want to like do an 8 hour job. It's just like somebody that is working, is shuffling two jobs and is getting
Okay.
like the minimum wage. You can't
Mm,
compare whatever the person's get to somebody that is working a 12-hour job. Do you get my
okay.
point? So those are it's just it depends on whatsoever you want.
But like as for example, as a public health nurse, like can you also um venture into other roles? For example, I'm a registered nurse, I'm not a public health nurse. I cannot just like for example apply to work in a long-term care or even pick up a shift. That's if I'm interested in working in a different setting in my organization. Like is that something you can do? Can you work in a different setting aside public health?
Yes, yes, you can. But now this is how it works. For any setting you want to work in, you must first of all be oriented in it. You need to get the orientation, right?
Okay.
Because you can't just I can't right now as a public health nurse, I can't just go into the hospital and be like, I want to pick up a shift. No,
Yeah.
it doesn't work that way here. So you have to get the basic
Some form of
orientation.
training. Yeah.
Yes, know what they do there, how they do it, how they do their documentation. Because I believe the way we do our documentation is a little bit different. It's almost the same, but it's a little bit different from how they do the orientation in acute care and emerge. So
Yes.
those are the things. That is why you need the training. You need to know how the floor works, right? Where you can get like the basic things and the rest of them. So yes, so you can't just go into those jobs. You have to be oriented in it. Yes.
Okay, thank you so much for this information. And for the purpose of this discussion, most of the resourceful link that you can use for all this application, like I said, I'm going to be putting it on the description of this live section. So for West, we all know that's the recommended for nurses who have a BSc. For the regulatory body, I'm going to try as much as I can to get 10 of them and put it on the description board. You can register with any regulatory body you're interested in because this is where you're going to get all the resource links. And for any information related to your immigration, you can also find all those information on the IRCC website. Um, like I always say, you can come in through the work permit pathway, depending on the way you choose. You can also come in as a permanent resident if you're ready to like spend more money, and depending on the number of family
Yeah.
members you're coming in with.
Yeah.
Because I think for the express entry, you need like a proof of fund. You need to do your evaluation, you need to pass your language
I
proficiency. But the
yeah.
good thing about it is that you're coming into a country as a permanent resident, which is even the major reason why, like, a lot of
Make
people, you
people
will just see the
migrate.
next
Yeah.
minute somebody you know that is in the UK. Before you know
Mhm.
it, the person is already in Canada, because
Yeah.
you can't just reach such nice opportunity for yourself and your family.
Mhm.
So you
Yeah.
can either take the work permit pathway or the express entry pathway. So now, what advice do you have for registered nurses? Because I know we are all registered nurses, both the people that are home and the nurses that are already here in Canada that are also waiting for their licensure. What advice do you have for nurses in general, or even new grads?
Well, I'm just gonna keep it short, and that would be you just know what you want, right?
Mm-hmm,
And you know for sure wherever you are right now is not where you would want to end. So you need to
mm-hmm.
put in the work, and you don't just put in the work and wait for something different to happen when you're not literally making it to be in the right path. If you know
Mm-hmm.
for sure, yes, you intend to write the NCLEX exam and you want to leave wherever you are to a different place, it mustn't be Canada, right? It can be
Yeah.
like maybe any other country. Now, you need
Yes.
to have a plan. And those
Yes.
plans, as I said, it doesn't have to be like a long term plan, like, I mean, 1 year, 2 years. No, make it short and strategic. Okay, you know you want to write this exam, give yourself 6 months. It depends. I know sometimes some persons will be like 6 months cannot become, it might not work based on they have families and they have kids and the rest of them. But one thing I know for sure is that once whatsoever you put your mind to it and you pray and like have a good plan, it works. Okay, so try as much as you can. It yes, it actually, when they said greener pastures, yes, there is greener pastures for us.
Don't
Yes.
mind those people that are telling you, so
Well,
recent people, the next minute you see people that are saying nothing is draining, blah blah blah, and all those
yeah,
things, but nobody
actually,
talks about like the
the
rewarding part.
benefits.
Okay,
Yes, nobody does
because
that.
when you look at where we're coming from, because
Oh
me,
yeah,
when I like to share from my personal experience, when you look at where we're coming from, I remember when I was with my internship back home, I was earning 102,000 naira every month, and you have to work for it.
yeah,
So imagine somebody that is earning such amount, and like you move and you even see that, oh, this is something you can even make something like this and more in a day. I mean, why won't you give yourself the benefit and like
yeah,
put in
yeah,
your best to do
yeah,
it? Do you
yeah,
understand what I mean?
yeah.
So that's what I honestly
The
think.
truth
And
is, sorry. The,
yeah, it's okay.
the truth, the truth is this. Like back home, I worked for like 2 years, and what I got in my first paycheck was almost times two of what I earned in 2 years.
You see, you see, do you see that? So
So it is rewarding. There's stress in it, yes, nothing is
2 years
stress.
in 1 month. So you
I'm
you you
saying
you can't
no,
even you
two
can't
years in
even
two
compare
weeks.
it.
No, 2 years in 2 weeks.
Okay, what you got 2 years back home, that's what you got in 2 weeks.
In 2 weeks.
So that's to tell you that, like, if what you would say, what is what doing is what doing well.
Yeah.
Okay, I'm not regretting all the time I gave in for my studies, because I remember how difficult it was for me then, because I,
Yeah.
I I I just had Florence recently, and I had to like leave everything, in the morning when I wake up, I feed her, I do this, put myself together, and I start studying. So, like, anything is going to take for you to like get your RN license. This is like a ticket to, there's nowhere in the world where you cannot practice. If you
Yeah.
choose not to live in Canada today, you can just move to Australia, you will still figure a way out.
Yeah.
And you choose to move to the US today, there's something for you. If you're
Yeah.
planning to move to New Zealand, there is something for every RON. So like I feel, even as a student, my dear, start figuring a way out.
Yeah. You
Start
don't have
studying
to
for
wait
your
for the end.
IELTS.
Yeah.
Research about it. If possible, pick up the sandals. Just read them through. Do you understand what I mean? You could just
Yeah.
read once in a while, even if you feel you're not ready now. But like when you start on time, it gives you that age above people that don't even know. Because I remember when I was still in university, like I know that people were moving to the US, to Canada, and every other country, but like I didn't really know the pathway very well, like the way I know it now.
Yeah.
Okay. Because I remember some of my colleagues then, they were doing their IELTS. When I hear them talk about IELTS, I'll just be like, what is this? What is IELTS? What is what I'm talking about? You know?
Yeah.
And finally, when I got to know what these things are, I became scared. Why? Because I thought I was not prepared. I was going to fail because this exam is Canada exam, is US exam. So you think you cannot do it because
Oh yeah.
men, other people are doing it. I mean, I always tell people, if I can pass the NCLEX, you
Anybody
can also
can.
pass the
Yes.
NCLEX, okay?
Yes.
If I
Yes.
can pass the NCLEX, you can pass the NCLEX. You just need your what's it called? Your content. The content is the most important because you need, if you don't have your content for this examination, I don't know what to say.
Oh
But
yeah.
my sincere
It's
advice to,
content, and your questions. Like content,
yes,
because you can't just go into this exam if you don't know what it feels like
yeah,
to be in the exam setting. And if you're practicing for your questions, this is what I'd say. Practice like you're in an exam setting. Leave your phone. If it's 1 hour, 30 minutes, if it's 9 hour, 90 minutes, leave your phone. Do it like you're in an exam. Feel the tension. Know what it feels like. Like I can remember when I went into the exam, like I was anxious. I wouldn't tell you I wasn't anxious, but I had like a previous experience of what it feels like to be there. Like you're just there and you know your time is ticking and the rest of them. And I'm like, if I can do it, then if I can pass those questions, then why can't I pass my exams? So those are the things like you should look out for.
yeah. That's
You
why
just
those stimulation tests are very
oh
important.
yeah,
Invest
oh
in it.
yeah,
Get your question banks, study with people. Because I remember when I was also studying, I had like a group of nurses where we're able to like finish the standards. Okay, like every day someone comes into the group and like read to everybody. So when it's your turn, you also read to the group. So
mm,
like if you're someone that can't study alone on your own, or you don't have like a timetable for yourself, you can just get like a group, join a group. There are a lot of
yeah.
group for nurses out
And
there, a lot of group,
there's one
even
thing about
group where you
joining.
can find international educated nurses, different people from all walks of life. I have a bunch of group I was in, like where I was reading questions, answers, materials. Once in a while they send in resources there. So join groups, um engage with people, ask questions. No question is a waste when it comes to your licensure pathway or anything that has to do with your immigration. No question is a waste. Don't be shy of asking questions. Personally, I have a way where people always reach out to me. If they don't reach out to me on my Facebook, they send me an email. So ask questions. Even if it's not me, ask people around you. I know that people that are already in this journey are always willing to help. I will also put in Nurse Christie's handle on the description box, so you can also feel free to like ask her any question that is relating to how she immigrated, how she transitioned from RN to public health. That's if you're interested in any profession that does not have to do with bedside. No, me, I'm a bedside nurse. So that's it for today. Do you have like any further contribution, anything new you want to add, or something you want to tell our viewers before we call it a day?
Well, I think we've basically touched almost everything, right?
Yeah,
So whenever you stumble on this video, this is my advice to you. If I and Nurse Rachel can do it, you definitely can do it. And
yeah,
no time is late. Okay? No time is late. You just need to have a good plan. As I said, she said that you should have like groups. But now this is one thing. Whoever you're having a group with should be somebody of like minds with you.
yeah.
Okay? Don't if you know you want to write your exam this year, you can't be in a group with someone that want to write their exam maybe in next 2 years.
Next year, yeah,
It doesn't work. You have to be with somebody that has the same vibe, the same energy as you have. The person, someone as passionate as you are about trying to transition into a different area, or maybe get a new achievement for the year. So those are the things you should look out for, and you can do it. Just have a good plan. Okay. Yes, it can be daunting actually. Yes, I was scared. I was anxious. At some point, I had the imposter syndrome. Can I do it? Can I not do it? Oh no, I think I'm gonna fail and the rest of them. But why would you have a conclusion when you haven't even tried yet? So you can do it. And even if you try the first time you didn't get it, try again. There's no
Yeah.
harm in trying again. Nobody said you should write you're going to write it for 5 times, and if you don't write it, you're going to be disqualified. No, keep trying. Because why I'm saying this is the end result of it is even the most rewarding part
It's
of it.
rewarding.
Like sincerely, when I got my mail that I passed my exam, I don't think I've ever felt so excited. Like I think the time I actually did feel that way was when I passed my RN in Nigeria. Like it was a major breakthrough. I was so excited because I know for sure, like my name has been crested on this. It can never be taken out, and it's for life. It's not something I have to go and write my exam again in the next 2 years. So it's
Mhm.
worth investing in and try as much as you can. Pray God is going to help you, and you would get it. Thank you.
Thank you so much for this live section. And my advice from you guys to you guys is that by the time you will get your first paycheck, you will not even remember this video again. You will not
Never,
remember I existed. You will
ever
not even remember you listened
at
to
all.
me.
The
So
stress will wipe out.
as much as you can, invest your time, invest anything it will take for you to get your licensure. And at the end, I promise you, you'll be proud you did this for yourself. So for everyone that joined today, my name is Nurse Rachel. Don't forget to subscribe to my channel, and thank you so much for joining. If you come across this video in future, please don't forget to like tell your friends about me. Let them know that we're sharing the real deal on this channel. And
Yeah.
I hope this information will help someone. Bye, guys.
Thank you. Bye.
Thank you so much for joining, guys. Bye.